Hi, I'm Patrick. I'm a doctor by training and I'm now one of the team members at Concentric. Welcome to this training video on Concentric's digital consent application. During this video, we're going to walk through how to use Concentric using a few clinical scenarios. After watching this video and reading our onboarding guide, you should feel comfortable to start using Concentric. You can see our onboarding guide, including any organisation-specific information about local integrations with other clinical systems at concentric.health/onboarding. You're welcome to just watch this video, or you can open the Concentric application and create consent episodes along with me. Concentric is accessible from anywhere on a web browser. Depending on how it's configured where you work, you can access it directly and possibly also via an inpatient context launch through your electronic health record. For the purposes of this video, I'm going to be using our demo environment, which is accessed at demo.concentric.health. You should use the environment you've been given access to, but please make sure you're using a test patient record. Details of adult and child test patient records are within your onboarding guide in the Let's Get You Started section. Your onboarding guide will state the mechanism you should use to log in, either a single sign-on mechanism used by your organisation or your Concentric username and password. If you're ever unsure as to which login option to use, click on Not Sure How to Log In on the login page and select your healthcare organisation. Once you've logged in most cases, it is this homepage that is shown, with the exception of when you followed an inpatient context link, at which point you go straight to the patient record. In the top right-hand corner is the name of the user logged in. Clicking on this name brings up a menu including basic account settings and links to give feedback or make content requests. The logo of your healthcare organisation will be displayed in the top left corner, where here you see a Concentric logo. Clicking on the top left logo at any time will always bring you back to this home screen. To get to the required patient record, you can either use the search bar, or if you need access to an episode you've recently interacted with, it can be quicker to toggle recent episodes. The search bar will have a placeholder stating how patients can be searched, for example by using an NHS number. In this training environment, we have a few test patients set up, so I can search for one of these now. There'll be details of your test patients in your organisation's Getting Started guide. If your organisation's Concentric is integrated with your electronic health record, you will simply search by the patient identifier. If your Concentric is not integrated, you will see an option when searching to select an existing patient or to add a new patient record. Our first clinical scenario involves an adult test patient. For me, their hospital number is 123456. Searching this loads the patient's Concentric record. There are two parts to the page here. At the top are the patient's demographic details, and below the demographic details is a list of consent episodes created for the patient, listed with those most recently edited at the top. We could go and view these previous consent episodes, but let's begin by creating a new episode. Clicking New Episode brings up this search bar, which allows you to search through thousands of treatment templates, using logic to bring the results that you're most likely to be looking for to the top. It also has your most commonly chosen treatments below. These start to show once you've created your first consent episode. For this first scenario, we have an adult patient who is giving their consent during a face-to-face clinic appointment. The plan is to perform a total knee replacement, so we can search for that in the search bar. Note that you can also search using abbreviations. In this case, by typing TKR. As this is a sided treatment, we need to choose a side. There are other customizations that can be done on this page, but we'll cover those in another scenario. On clicking Continue, the consent template for the selected treatment is now shown. At the top of the page remains the patient bar, and the episode bar is now below that, with the treatment name, an icon to demonstrate the state of the episode. Here, the dotted line means that it's currently in draft form, and quick select actions that change depending on what might be appropriate at that point in the process. Next, we have a status bar, the darker green colour bar, which gives some more context regarding the state of the episode and guidance regarding what to do next. Here it states that we need to select the information that is relevant for the patient. Clinician view has a number of elements that are required to be shared as part of consent information, such as indication for treatment, alternatives, and risks, presenting quick select options, but with the ability to personalise to the individual patient as much as is appropriate. This is an adult patient, so we're presented with consent form 1, i.e. patient agreement to investigation or treatment, and consent form 4, treatment in best interests, as the two options. We'll see later that if I change the selection to a consent form 4, Concentric requires different information, and equally for a child patient, the appropriate consent form types are shown. In this scenario, the patient does have capacity, so we can keep the default consent form 1 selection. Each patient and consent episode should have a clinician who is ultimately responsible for their care. Their responsible clinician, historically the name above the bed. This is usually their consultant. If the individual logged in is assigned as a responsible clinician within their Concentric account, then this element will default to that individual. If a member of the team, for example a registrar, has created the episode, then they will need to select the responsible clinician using the search bar. For this test episode, choose to do whichever is most appropriate for your scenario. In the demo environment, I'm going to select Ian Gill as the responsible clinician. You will likely have a different list of names that you can search for via the search bar. Select the relevant indication, purpose, alternatives, and anaesthetic options. As mentioned, we can personalise the quick select template as much as required, for example by adding a different alternative. We can do this by clicking Add Alternative. Here, as for the other elements, there are thousands of concepts that we can utilise. For example, if I type total hip replacement, I can select this as an alternative, including any linked information, such as a lay description of the term. Equally, we can add a term that Concentric is not yet aware of. For any of these elements, we can also add clinician notes to share some additional context or to document a discussion. These are also visible to patients. I'll show you how all of this looks to patients shortly. The next section we come to is risks, and there are a few additional things to note here. Firstly, risks are divided into timing and likelihood categories. Secondly, risk templates are population-based, so, by default, are not personalised to the individual beyond being for the treatment being considered. As the patient's clinician, it is your responsibility to ensure the information is appropriate for the patient's context, including making any edits to the template. Often we'll click Select All Risks. For this scenario, I'm also going to edit a likelihood. We can do this by changing the likelihood bucket, i.e. common, less common, or rare, or by stating a specific percentage if it's known. Let's make the likelihood of blood clot 2.5%, so that it shows as a 1 in 40 chance. You can also remove a risk if it's not appropriate for a patient. All the core information that is required in terms of informed consent is included within Concentric, including supportive lay descriptions for any medical terms. However, in addition, it's also possible to signpost to other resources from trusted sources, for example, to information from the Royal Colleges and to video information. Using the same principles as elsewhere, there are recommended resources that we can select for sharing, but it's also possible to share other information that may be relevant for the individual patient. For example, smoking cessation information. The final element is the additional consents. These are any linked consents that may be given at the same time as the treatment consent. For example, consent for blood transfusion or inclusion in a joint registry or similar. The relevant options are presented depending on the treatment selected. Once the relevant information has been selected within clinician view, it is ready to share with the patient. This can be done in several ways, depending on the context and clinician preference. In this scenario, we'll use consult view to guide the consent conversation between the patient and clinician. Consult view takes what's been selected within clinician view and presents it in a patient-facing format. This can provide structure to a consent consultation and is the same information that patients have access to in the Concentric patient application. During a consultation, the information is generally talked through at the level presented, but much of the information can be expanded, either with the clinician or more commonly in the patient's own time, to show additional information where appropriate and useful to do so. Consult view is divided into a few sections. Firstly, broad information regarding what the treatment involves, the indication and purpose, as well as the alternatives. As in clinician view, notes can be added to any section to add context or document conversation. The second page, for relevant treatments, outlines the anaesthetic options, again with additional information, for example from the Royal College of Anaesthetists. On proceeding to the risks page, we can see these again divide into timing and likelihood. Visuals aim to support understanding, and risks are supported with additional information to share the context with patients of what the complication may mean for them should it occur. Occasionally, information about reducing the likelihood of a risk or what to do should certain signs or symptoms present are also shared. The final page, prior to the consent flow, is where links to additional resources are shared. These will often be a combination of national and local links and resources. At this point, we reach a page titled "Are you ready to consent?" You can think of concentric information as having two sections, a section of consent information and a consent flow section. We've just walked through the first section. Depending on the scenario, it may be appropriate to continue to document consent at this point, for example, prior to emergency surgery, or it may be more appropriate to share the information with patients to consider in their own time, and, if appropriate, for consent to be documented subsequently, either remotely, without the clinician, or during a later appointment. We'll show the other workflows later in this video. For this scenario, we're going to proceed to document consent. If an interpreter is being used, this box is selected, which then prompts the documentation of key information, the interpreter's name, role, language, and any notes regarding the interpretation can be added. Let's deselect that box as an interpreter is not being used in this scenario. Within the consent flow, the next page we see asks whether the treatment will take place within 24 hours. This defines whether a confirmation of consent step is required. If treatment is planned within 24 hours, then Concentric does not expect subsequent confirmation of consent. If it is planned for later, then a confirmation of consent step is expected. For this scenario, we're in an outpatient clinic, so let's state that it's more than 24 hours until treatment. The next page shows the consent statements for the patient to agree to. There are scenarios where these are automatically modified, for example, removing the consent statement relating to reviewing the anaesthetic plan if it is a treatment for which anaesthesia is not required. Once the patient has read these and clicked continue, any additional consents are presented. There are a number of ways these are structured, depending on the requirement of the additional consent. For example, signposting out to external information, and maybe one or multiple questions. Here we see the blood transfusion example. Once a selection is made, click the Sign Consent form to proceed to the signing page. As a clinician, you electronically sign by virtue of being logged in. This page documents the patient's signature. If you're using a device with a touchscreen, a signing area is shown for the patient to add their signature with a finger or stylus. If you're on a device without a touchscreen, a QR code is shown with guidance on how to use the QR code to bring up a signing page on a touchscreen device. Information can be shared at many points during the Concentric process, including following signing to give consent. Secure access to the Concentric patient application with the patient's personalised information, including the completed consent PDF in this scenario, can be shared via email or SMS. Where possible, contact details will be brought through via integration to pre-populate these fields. To demonstrate what the patient receives, I'm going to enter my email address here. If you're following along with your own consent episode, enter your own email address here to see what the patient receives. The email and/or SMS are sent by Concentric on behalf of the healthcare organisation, personalised with your healthcare organisation's logo, and therefore do not expose your contact details as a clinician. In the communications is a secure link to the patient's information, and following entering the patient's date of birth, you can see the information we've just gone through. On the day of treatment, I can log into the clinician application, search for the patient, find the relevant consent episode, and confirm consent. I can also document any conversation on the day of treatment here. Once consent is confirmed, a green banner is shown, denoting a complete, ready for treatment consent episode. To check consent prior to treatment, for example during a surgical safety checklist, either this view or PDF view within Concentric can be used. Otherwise, the PDF may be shown within the main electronic health record, depending on local preference. There'll be information about which is the preferred option locally within your onboarding info. That completes our first scenario, in which we've covered the majority of what you need to know to get started with Concentric. The next few shorter scenarios cover some of the other workflows and other consent form types. Let's return to the Concentric homepage by clicking on the logo in the top left corner. In our second scenario, we have an adult patient giving consent remotely following a consent conversation. Remote consent can be enabled following reviewing consent information in Consult View, but here we're going to use the scenario where a clinician has had a consent conversation with the patient without using Concentric's Consult View and is then sharing for remote consent directly from Clinician View. I'll use the same adult patient I did in the first scenario. Again, your local test patients will be in your onboarding info. The planned treatment for this scenario is a skin-sparing mastectomy and sentinel lymph node biopsy. Concentric makes it easy to manage combined treatments. Simply search for the combination in the search bar. If it's a combination that Concentric is aware of, then they will be presented together within the search results. As in the first scenario, the side needs to be selected. In the case of combined treatments, we have the flexibility to select different sides for the different elements if required, by selecting the Customize button. On loading the template for the combined treatment, Concentric will apply some logic, such as removing irrelevant indications or duplicate risks. This scenario, again, involves an adult with capacity, so we'll continue with consent form 1. Assign yourself as the responsible clinician. Remember, you should only do this in a non-test environment if you are the responsible clinician for the episode of care. This time, for indications, I will demonstrate how an indication that is not on the initial template can be selected. For example, inflammatory breast cancer. I can also add a note about this, for example, to say how this diagnosis was made. I'll also select a purpose, some alternative treatment options, and an anaesthetic option. While selecting risks, we can press Select All Risks and then remove one. In this case, for example, removing shoulder stiffness. Let's now share with patient for remote consent. Again, putting in my own details just for demonstration purposes. Select that you're happy for consent to be given remotely and document the consent conversation held. I will include a message for the patient. As shown previously, the patient can then access their information, explore the additional descriptions, and follow signposting to other information from trusted sources. When remote consent is enabled, as in this scenario, the patient can proceed through the consent flow and sign their consent. They can at any point state that they're not ready to proceed, contact the organisation, or come back to give their consent later. Once consent is given remotely, this automatically updates the Concentric Clinician application with the consent episode in an awaiting confirmation of consent step to be done on the day of surgery. There is also the option to revoke consent and document a reason. Let's state that the patient no longer wishes to proceed with this treatment. If we now look at the consent form PDF by clicking View Consent Form PDF at the bottom of the page, we can clearly see that consent has been revoked. That concludes the second scenario, covering enabling remote consent, which is currently used for around a third of consent episodes on Concentric. Let's return to the Concentric homepage by clicking on the logo in the top left corner. For our third scenario, we're going to switch to a consent form 2 scenario, a child patient at the bedside on the day of surgery. In my case, the hospital number for a child test patient is 444444, but yours may be different. Again, check your local onboarding info for the ID number to use for a test child patient within your Concentric deployment. As previously, click New Episode and search for the treatment. In this case, a laparoscopic appendectomy. For this 12-year-old patient, the only option presented is Consent Form 2, where a parent or a person with parental responsibility needs to state their agreement to investigation or treatment for a child or a young person. This means that it's the parent or guardian who will document the consent with a signature. For children and young people aged 14 to 17, both Consent Form 1 and 2 options are presented, so that the correct option can be used depending on the circumstances. There's information on the Concentric website which can be a useful refresher on what the default option should be depending on age. Search the web for Concentric Consent Form 2. It's good practice to document a capacity assessment for consent episodes involving patients who are 14 to 17 years old, and should be completed where a consent type is being used that is not the default option. For example, when completing a Consent Form 2 for a 17-year-old. I'll assign myself as the responsible clinician again, and select the relevant options of the template. Let's select all risks and demonstrate how risk can be added to the template. Let's add salpingo-oophorectomy as an immediate rare risk. Add the risk within the appropriate timing bucket, here immediate, search for the concept, then select the appropriate likelihood. I can add additional patient information resources to support the patient. For example, adding the Respare has an anaesthetic story for children preparing for an anaesthetic from the Royal College of Anaesthesia. We can then go through Consult View, which generally presents the information with the same structure as we've seen previously. There are some differences once we reach the consent flow. Firstly, on the Are You Ready to Consent page, we can see information regarding parental responsibility and who can give consent on behalf of a child or a young person has been added. Before proceeding, the parent or guardian must confirm that they are in a position to give consent on behalf of the patient and document their name and relationship to the patient. In this emergency surgery scenario, we state that it's less than 24 hours until surgery, which means that the consent episode will be completed when consent is signed. Concentric will not expect a further confirmation of consent step. Following review of the consent statements and any additional consents, the parent or guardian is then asked whether just they, or both they and the patient, will sign. The parent or guardian is the one providing their consent from a medico-legal perspective, whilst the patient can sign their assent, a demonstration of their agreement to proceed, if they're of an appropriate age and maturity to do so. In this scenario, let's say that both will sign. The same process is followed for both, with the same options that we've seen before in terms of signing on screen or on another device. The child or young person signs first, followed by the parent or guardian. In some scenarios, digital information may not be accessible, so let's say that information won't be sent electronically this time. The information can be printed and given to the patient, including any customizations and notes made. Information should always be shared with those giving consent, either in digital or in print form. On returning to clinician view, we can see now the top bar is green, meaning the consent episode is complete. The key information for any checklist processes are shown within this view and replicated on the consent form PDF. This includes both signatures. That completes our third scenario, outlining the differences between the process for completing a Consent Form 1 and a Consent Form 2 within Concentric. Let's now return to the Concentric homepage. For the next episode, I'm going to demonstrate the final consent type, Consent Form 4. A Consent Form 4 should be used when treatment decisions are being made in an adult patient's best interest, due to the patient lacking capacity to make the decision themselves. Capacity means the ability to use and understand information to make a decision and to communicate any decision made. We'll use the same adult patient we've been using for previous scenarios. Selecting a treatment follows the same pathway we've seen before. This time, let's select an exploratory laparotomy. When we change to using a Consent Form 4, the button to Add to Capacity Assessment and an additional button to Add Best Interest Decision Documentation are marked as Required for Consent. Let's complete the capacity assessment first, which follows the requirements set out in the Mental Capacity Act. The first two boxes require us to document the reason for conducting this capacity assessment and the support being provided. We then proceed to complete the 4 standard capacity questions: whether the patient is able to adequately understand the information, retain the information for long enough to make their decision, use or weigh the information, and communicate their decision. For each, we state our assessment, and it's recommended to add some evidence to support the decision. An overall assessment of capacity is then recorded in the final question. If this answer seems at odds with the answers to the 4 capacity questions, a warning message will now show. Following completion of the capacity assessment, best interest decision documentation must now be completed. Depending on the initial answers for each section, other questions may be presented. In this scenario, it's not likely that the patient will regain capacity, and they do not have any advanced decision in place to refuse the treatment. If the patient did have an advanced decision in place, I would click yes, and, as you can see, a further section would appear to document the details of this advanced decision. For the section on other forms of authority, you can see that if the patient has a lasting power of attorney or a personal welfare duty, we can include their details here. In this instance, I'm going to say that the patient has neither, and therefore the responsible clinician becomes the decision maker. Where the responsible clinician is the decision maker, 3 additional questions are presented: documentation of alternatives and risks of not carrying out the treatment, any information available regarding past and present wishes, and any consultation with those close to the patient, or the representation made by an independent mental capacity advocate. We can now save this best interest decision documentation. As before, I will assign myself as responsible clinician and select the relevant information from the template. This episode is now ready for confirmation of a decision regarding treatment in best interests. As per the best interest decision documentation in this scenario, the responsible clinician will now do so. On clicking Proceed, a confirmation of who should complete this page is shown. Any additional consents are documented, and an overall summary regarding the decision is documented. On completion, we see the summary view confirming that a treatment in best interest decision has been made by the responsible clinician. We can view the completed PDF, here a consent form 4 PDF, which includes the capacity assessment and best interest decision documentation. That completes our 4th scenario, outlining the process for a consent form 4. For our 5th and penultimate scenario, we have an adult patient who is going to have a treatment for which there is currently no concentric template, allowing us to see how consent is created from a blank template. Let's use our usual adult patient and click New Episode. If I type endoscopic biliary duct stent change, there are no results shown, i.e. there is no concentric template for this treatment at present. I can create a blank consent form. I'm now prompted to add a description for the treatment that the patient will see, the lay description, and then state that the procedure is not sided. This page should look familiar, and on clicking Continue, we reach the template page, with an additional info box stating that a blank template has been used. You can see that, as expected, there are now no pre-populated concepts on the template, so the relevant information needs to be added to each section. I can still use the thousands of concepts within Concentric to speed up the process. For example, I can add biliary stricture as the indication, with the lay description that already exists. Once the information is selected, Consult View can be used as per the previous scenarios. The functionality is then exactly the same as for the other scenarios where a template had been used. As you can see, this provides flexibility for Concentric to be used at all times, even when a template does not exist. Over time, the likelihood of needing to use a blank template reduces as our library of templates increases. For our final scenario, we're going to show what happens when a patient goes through information with their clinician in person and then has this information shared with them for remote consent. This time, I'll skip to an episode I prepared earlier and jump to the Are You Ready to Consent page that is shown following walking through the consent information in Consult View. Let's imagine that the patient and clinician have discussed through the Consult View information in clinic. Often, clinicians will at this point state that consent is not going to be documented, but rather shared with patients to consider in their own time, and, if appropriate, can give consent remotely. So let's select No Not Yet. This allows me to share the information with the patient, at which point I can enable remote consent. This will send the information to the patient digitally as previously, and remote consent can be completed as seen in our second scenario. That concludes our training video. I hope you found it useful and now feel comfortable to start using Concentric. If you have any questions regarding getting started with Concentric, please visit our website at concentric.health/onboarding or contact us at support@concentric.health. Thank you for your time.